Welcome back to The Wellness Effect. Subscribe to our channel and hit that notification button so you don't miss out on any of our insightful discussions. In this episode, Professor Shingai Mutambirwa will help us understand a bit more about prostate cancer. Welcome, Professor Shingai.
Thanks very much, Seth.
So, Prof, what is prostate cancer?
Okay, I think we usually start with the anatomy. I think it's important to remember what the prostate is. It's a little gland that's sitting around the pipe for passing urine, which is also the pipe for ejaculation, which we call the urethra. And it's just under the bladder, so it's quite deep in the pelvis of a guy. And what it's doing is we know that sperm are made in the testicles. Sperm travel through a long tube that called the vas to the area of the prostate, because most of what a guy ejaculates is not sperm. Less than 1% of what we ejaculate is sperm. Most of what comes out is stuff made by the prostate and another gland called the seminal vesicle. These are things like sugars, proteins, and stuff which support the sperm outside the body. And the reality is that the prostate is one of the most problematic things for guys as we get older. It gets bigger after around the age of 40, and the normal bigness, which we call BPH or benign prostate hyperplasia, can block up the pipe and give difficulty passing urine. But it's also the commonest site for cancers after skin cancer in men. And the reality is that because the prostate cancers usually develop on the outside part of the prostate, which is next to the rectum and things like that, you often don't get symptoms until it's too late. So we encourage guys through our Prostate Cancer Foundation to get their blood test called a PSA, or prostate-specific antigen, which gives us an idea of a possibility of cancer in patients about once a year after the age of 40. Because if we pick up prostate cancer early, it's very easy to cure.
And do you generally note that your patients showcase symptoms post-40, or is it only
Before.
could it be earlier?
Well, it is possible. But I remember that one of the biggest issues, and one of the reasons why we're doing a lot of our genetic testings and things, is that we do know that Black Africans particularly have a higher risk of getting prostate cancer, and they usually get the more nasty types of cancers as well. And so we do have cohorts of patients who in their early 30s who have got prostate cancer as well. A lot of them, the bird has already flown the cage. They've already gone to become stage 4. But the thing is that as a general rule, we have to have specific guidelines. And that's why our local Prostate Cancer Foundation says from 40, when most of the international guidelines say you should be getting this blood test from about 50, 55. But they've got a different cohort of people because it's mainly Caucasians and other people. So I think just generally for Black guys, in fact, for South Africans and Africans in general, let's just get ourselves checked. If we pick it up early, easy to cure.
Amazing. And what is the check? Is it just that blood test?
Yeah, I know a lot of guys out there, when they do hear about prostate, they're thinking that we're going to have to put our finger in the backside to actually feel the prostate, which is helpful in some cases. But our new guidelines say that that's not necessary.
Great.
All you need to do is to go see your healthcare provider. Literally, it's 5-10 minutes in your healthcare provider's suite. They ask a few questions. Are you having difficulty passing urine? Do you have diabetes? We do a couple of blood tests, including sugar, to check your blood pressure. Because the main killers for everyone in the world are what we call non-communicable diseases, which would be heart attacks, strokes, loss of limb, cardiovascular disease, and cancers. And they're interrelated. 80% of us will die from that. But we can pick them, if we pick them up early, easy to cure. So you just get that examination done, get a couple of blood tests, including the PSA. If the PSA is raised, then we have a discussion about what needs to go on further. But besides that, you're literally in and out of the office within 10 minutes, really. And guys, in general, we know we're far worse than female compatriots. We see our healthcare providers 5 times less than females. And that's one of the reasons why females live at least 6 years longer than guys.
Oh, wow.
We can make a change. So as guys particularly, and as partners of guys, please make sure that you get checked once a year, and we should be able to manage you quite nicely.
And what are the symptoms, Professor?
Essentially, because prostate cancers don't do much of anything until they start spreading, and they love going to bone. So a lot of people will get bone pains and things like that when it's stage 4. But before that, there's almost no symptoms. And that's unfortunate, not only for prostate cancer, but for almost every cancer.
Yes.
And again, that's one of the reasons why you should be seen by your healthcare provider. And if you have any abnormal symptoms, do get yourself checked. But the short answer is that there's no symptoms. You need to get the blood test taken if we're going to find the cancer early. and then we're going to be able to cure it. Once you've got symptoms, usually it's already spread and it's no longer curable. Still treatable, but no longer curable.
And what's the effect of early screening in treating the prostate
Prostate.
cancer?
Yeah, if we do pick up the blood test is raised, usually we don't react immediately to it because there are other things that can make it rise. But if we do find that it's still raised after we've given it a month or so, then our next step is usually to do specific X-rays to look for if we need to look for a cancer, because a lot of the blood tests, let's put it this way, about 50% of prostate cancers will not give you any problems, and if you live long
Okay.
enough, almost every guy will get prostate cancer. So we're trying to look for the nasty ones, the ones that are going to cause you problems. And if we find on this X-ray called an MRI or magnetic resonance imaging that there is something funny going on here, we'll do a biopsy. We'll then pick up if there's a cancer. If there's a cancer there, then we have to do what we call risk stratification, where we look at whether you're low risk, intermediate, or high risk. And it's really just a numbers game, because the point is, even if you've got high risk localized prostate cancer, with management, you've still got at least a 60-70% chance you'll be cured over the next 10-15 years.
Wow.
But the point is that we want to get it early so that we can actually implement therapies. And the therapies are pretty simple. For our purposes, only 3. We might just watch the cancer if it's low risk and just check once in a while what's going on. The other 2 are what we more intimate activities. One was radiation therapy, where we can actually put radiation seeds or give external beam radiation, and the other is to do surgery to remove the cancer. For our purposes, they're all equally effective, depending on what the risk stratification is. But again, the active surveillance looking at patients is only for low risk. Intermediate and high risk, you need to have surgery or radiation.
You've mentioned that you're doing some research on why African men have a higher risk to prostate cancer. Could
Yeah.
you maybe just take us through what you're finding in that research?
So it's one of my pet projects, so it's really quite exciting. Our group has actually sequenced the first full sequence of a Black African man, and that was Archbishop Desmond Tutu. Actually, he was our patron, and he was so generous with with giving us the data. We published on this, and we found some intimate things that happens in our genetic makeup, and not just genetics, it's genomics, because it's not just about the DNA. There's also other things like the cells that are around there, and this and the other, which do impact on it. We haven't reached we don't really know why it happens, but we do have some background now into some specific types of genes which are more expressed in Black Africans.
Okay.
Remember, a lot of the data before we started in the rest of Africa was from America, and African American men do have a higher risk of prostate cancer and more likely to die. But that cohort is really West Africa more than anything else. But we now have cohorts from Venda, from Swatini, various other things. All of them are slightly different. And I think that's one of the key take-home messages for when we're discussing assessment for risks, is that Africa is not one people. We're multiple different people. We're all many Nguni, like, for example, Nyama. So it's the same name in every country in Africa.
Absolutely, yeah.
But the point is that we have our different genetic makeups. And I think that's important for us to remember. But going forward, I think the more important thing for us is to make sure that we actually do recognize that we as Black Africans do have a higher risk, and just make sure you get yourself checked early.
Sure. Is that a result of environment, lifestyle, weight?
Great question. Yeah. I think a lot of people always like to ask if there's anything specific that you could do to change
Yes.
your risk of getting prostate cancer and other cancers. And I think basically for every cancer, including prostate cancer, it's the big 5. We're in Africa, we've got the big 5. The big 5 for health is a bit of physical activity. Don't consider exercise. Exercise makes people get scared. They think, oh no, they got to do stuff. This 10,000 steps nonsense, that was set up by a Japanese company which actually produced the first smartwatch. And it was just a thumbsuck. You don't have to do 10,000 steps. Any form of physical activity improves your outcomes for cardiovascular disease and cancers, all cancers, including prostate cancer. Second is a diet. And again, it's about the numbers of calories and the types of calories. It doesn't matter if you've got a big package of chips and you say it's low fat, but it's got huge calories, it's still going to cause you a problem.
Yes.
Similarly, highly processed foods, we know they affect the body, particularly our gut microbiome, because we actually have 10 times more bacteria in our body than we have cells. So we're actually a bacteria walking around with a bunch of cells. And most of those guys are good guys. They're
Okay.
actually helping. So that's why this excessive use of antibiotics, eating ultra-processed foods, which in America, for example, 70% of their energy comes from ultra-processed foods, which are impacting on the obesity crisis as well as our cancer and heart disease. Third is not smoking. I don't want to pontificate, but it's the most important social choice a person can make for their health. It doesn't only impact on prostate cancer, it does, but it also lung cancer, which is the leading cause of death from cancer. 80% it's something to do with smoking.
Wow.
So not smoking. The fourth one is no excess of various drugs, including alcohol and stuff. I'm a victim of the alcohol, so I have to cut back a little bit, I'm sure. But try to decrease the amount of drugs that you're taking in your life. But I think the fifth one is one of the ones which is really underestimated for guys particularly, and that's stress. Depression, stress, anxiety. Some data shows that about 85% of adult South Africans have some form of mental disorders from stress, anxiety. It's not a Mickey Mouse condition. It's doing exactly, releasing the same chemicals that diabetes, high blood pressure are doing into your bloodstream, causing you to get heart attacks, strokes, loss of limb, and cancers. So let's just focus on that. But besides that, there are a few other things that can help to prevent cancer. There's some things called lycopenes, which are in cooked tomatoes, not too much. And also some data which we were also involved with, where if you have more sex, because you're emptying your prostate, it decreases your risk of prostate cancer.
Okay.
But there's no magic pill. I think the important thing is to just make sure that you live a decent lifestyle, make sure you get yourself checked with your blood test, the PSA, once a year from the age of 40. And besides that, there's really nothing much more you need to do. I think the important thing is for everyone to remember the information. Your program, Seth, and the rest are so important because they actually are bringing the light to our patients as well and to ourselves. Do take your health seriously, guys, particularly. And this is not cisgender as well. If transgender, everybody, we all have similar problems that need to be dealt with. Make sure you take your health seriously. Not too difficult to do. Just do the big 5 and make sure you see your healthcare provider once a year.
Amazing. Thank you for that powerful ending. Really appreciate your time and the insights that you've shared.
Thanks for the opportunity, and thanks to the viewers.
Pleasure. And thank you for watching. Remember to subscribe and hit that notification bell so you can catch every episode of The Wellness Effect. See you next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.